In the annals of medical history, 2025 marks a pivotal year, a year where science triumphed over seemingly insurmountable odds. It was a year that would be remembered for its groundbreaking achievements and the hope it brought to countless families around the world. For the first time, a team of visionary doctors successfully treated a genetic disorder within the womb, a feat that many thought was impossible. This monumental success was the result of years of relentless research, dedication, and the unwavering belief in the potential of medical science. Offering a beacon of hope to families grappling with devastating diagnoses, this breakthrough provided a new lease on life for many. Parents who once faced the grim reality of genetic disorders now had a reason to hope, a reason to believe in a brighter future for their children. This groundbreaking achievement, centered around a baby girl named Emily, and her battle with spinal muscular atrophy type 1, has the potential to revolutionize the medical landscape. Emily's story is not just about a single victory, it represents a monumental shift in how we approach and treat genetic disorders. The advanced medical technology used in Emily's treatment showcased the incredible strides that have been made in the field of genetic medicine. From cutting-edge equipment to innovative surgical techniques, every aspect of her care was a testament to the progress of modern science. Opening doors to a future where genetic disorders no longer dictate a child's destiny, this achievement has inspired hope and optimism. It has shown that with determination, collaboration, and innovation, we can overcome even the most daunting challenges. Emily's story is one of courage, resilience, and the unwavering belief in the power of medical innovation. Her journey from diagnosis to treatment and recovery is a powerful reminder of what can be achieved when we refuse to give up hope. Her parents, faced with a diagnosis that often carries a grim prognosis, refused to give up hope. Their determination to find a solution, no matter how difficult, was a driving force behind this medical breakthrough. Their unwavering determination, coupled with the expertise of a dedicated medical team, paved the way for an extraordinary medical breakthrough. This collaboration between parents and medical professionals was a key factor in achieving this historic success. Forever changing the landscape of genetic disorder treatment, this achievement has set a new standard for what is possible in the field of medicine. It has opened up new avenues for research and treatment, offering hope to countless families around the world. The world watched with bated breath as Emily's story unfolded. News of her successful treatment spread like wildfire, capturing the hearts and minds of people everywhere. It was a story that resonated deeply, a story that inspired hope and optimism, a testament to the indomitable spirit of the human will and the relentless pursuit of scientific advancement. Emily's story is a shining example of what can be achieved when we push the boundaries of what is possible. It is a reminder that with hard work, dedication, and a little bit of hope, we can achieve the extraordinary. This is the story of a medical miracle, a story that will be told for generations to come. It is a story that highlights the incredible potential of medical science and the power of human determination. A story that whispers of a brighter future for countless children yet to be born. Emily's journey is a beacon of hope for all. It is a reminder that no matter how difficult the challenge, there is always hope, and there's always a reason to believe in a better tomorrow. Spinal muscular atrophy, a debilitating and often fatal genetic disorder, casts a long shadow over families worldwide. This cruel disease targets the central nervous system, specifically the motor neurons responsible for muscle movement. As these vital nerve cells deteriorate, the body's ability to control essential functions like breathing, swallowing, and movement gradually diminishes. SMA manifests in various forms, with type 1 being the most severe and common. Babies born with SMA type 1 often exhibit symptoms within the first few months of life, struggling to hold their heads up, swallow milk, or breathe without assistance. Sadly, without intervention, most children with SMA type 1 do not live past their second birthday, their lives cut tragically short by this relentless disease. The devastating impact of SMA extends beyond the physical limitations, impacting the lives of families emotionally, socially, and financially. The constant care required for these fragile infants places immense strain on families, often requiring parents to make life-altering decisions to accommodate their child's complex needs. At the heart of spinal muscular atrophy lies a faulty gene, a tiny error in the blueprint of life that carries devastating consequences. This seemingly minor glitch in our genetic code can lead to profound and life-altering effects. This gene, known as SMN1, plays a critical role in producing a protein essential for the survival of motor neurons, the very cells responsible for muscle movement. Motor neurons are the communication bridge between our brain and muscles, enabling us to perform even the simplest of tasks, like walking, talking, and breathing. In individuals with SMA, the SMN1 gene is either missing or mutated, hindering the production of this vital protein. This deficiency disrupts the normal functioning of motor neurons, leading to their gradual degeneration. Without sufficient levels of this protein, motor neurons begin to wither and die, causing a cascade of debilitating symptoms. The loss of these neurons means that muscles no longer receive the signals they need to function properly. As a result, muscles weaken and atrophy over time, leading to the progressive muscle weakness and atrophy characteristic of the disease. This muscle deterioration can affect various parts of the body, including the limbs, respiratory system, and even the ability to swallow. The severity of SMA, as seen in the different types, often correlates with the amount of functional SMN protein produced in the body. There are several types of SMA, ranging from type 0, which is the most severe and can be detected before birth, to type 4, which manifests in adulthood and is generally milder. The inheritance pattern of SMA is complex, often requiring both parents to be carriers of the faulty gene for a child to be affected. This autosomal recessive inheritance means that each parent must pass on a copy of the mutated gene for the disorder to manifest in their child. Carriers themselves may not exhibit any symptoms, but they unknowingly carry the potential to pass on this devastating disorder to their offspring. This hidden risk makes genetic counseling and testing crucial for families with a history of SMA. Genetic testing plays a crucial role in identifying carriers and providing families with valuable information to make informed decisions about family planning. By understanding their genetic makeup, couples can assess the risk of passing SMA to their children and explore options such as in vitro fertilization with genetic screening. Advances in genetic research and testing continue to offer hope for early diagnosis and potential treatments, paving the way for a future where the impact of spinal muscular atrophy can be significantly reduced. Through awareness, education, and scientific progress, we can strive towards a world where SMA no longer casts a shadow over the lives of those affected. Section 4. A family's harrowing journey, facing an uncertain future. For Sarah and Tom Carter, the anticipation of welcoming their first child into the world was met with unimaginable heartbreak. What should have been a time of joy and excitement quickly turned into a period of anxiety and fear. Routine prenatal testing revealed their unborn daughter carried the genetic mutation for spinal muscular atrophy type 1, casting a dark cloud over their joy and plunging them into a world of uncertainty. The news was like a thunderbolt, shattering their dreams and leaving them grappling with a future they had never imagined. The diagnosis was devastating, a cruel twist of fate that threatened to rob their precious daughter of the chance to live a full and vibrant life. The weight of the news was almost unbearable, and the couple found themselves in a whirlwind of emotions, from anger and sadness to fear and confusion. Faced with the grim prognosis, Sarah and Tom refused to succumb to despair. They knew that giving up was not an option. Their love for their unborn child fueled their determination to fight against the odds. They scoured the internet, consulted with countless specialists, and clung to the slimmest glimmer of hope, determined to explore every possible avenue to give their daughter a fighting chance. They spent countless hours researching, reading medical journals, and reaching out to other families who had faced similar challenges. Their relentless search led them to a team of pioneering doctors at a leading research hospital, a team at the forefront of gene therapy and in-womb treatments. This team was known for their innovative approaches and cutting-edge research, offering a beacon of hope in an otherwise bleak situation. It was here, in the hallowed halls of medical innovation, that Sarah and Tom found a flicker of hope amidst the darkness, a glimmer of possibility that their daughter's story could be rewritten. The doctors presented them with a plan, a series of treatments that could potentially alter the course of their daughter's life. With renewed hope, Sarah and Tom embarked on this new journey, ready to face whatever challenges lay ahead, united in their love and determination to give their daughter the best possible chance at life. Section 5. A daring decision, pioneering treatment before birth.